Hello. This is a brief progress update on Pakistan's National Vision for Surgical Care 2025. First, I'll give an overview of Pakistan's demographics and disease burden. Then, I'll provide a brief situational analysis of the surgical system. And finally, I'll give an update of the progress of the National Vision for Surgical Care 2025. Pakistan has a population of 207 million and is divided into 4 provinces, 2 autonomous territories, and 1 federal capital area, as well as 1 federal administrative tribal area. 64 million of this population is under the age of 15, and 70 million of the population is living in poverty, with a GDP per capita of approximately $1,548. Life expectancy at birth in Pakistan is approximately 68 years, and the maternal mortality rate is 178 per 100,000 live births, and the under 5 mortality rate is about 75 per 1,000 live births. The leading causes of mortality in Pakistan are ischemic cardiovascular disease, neoplasms, neonatal disorders, and stroke, followed closely by road injuries, unintentional injuries, and rheumatic heart disease. The leading causes of morbidity are neonatal disorders, ischemic heart disease, and neoplasms, followed closely as well by stroke, musculoskeletal diseases, unintentional injury, and road injuries. Broadly, when we look at Pakistan's health system, more deaths are due to acute surgical illness than there are to all infectious diseases combined. It was predicted in 2011 that 187 deaths per 100,000 are due to acute surgical illness, while only 164 deaths per 100,000 were due to all infectious diseases. Now, I will give a brief situational analysis of the current surgical system in Pakistan to identify gaps and better inform the surgical planning process. Pakistan is somewhat different from the countries that have previously uptaken the National Surgical, Obstetric, and Anesthesia planning process. Pakistan's population is nearly twice as large as any country to have previously made an NSOAP, and its physician density is quite high at 98 per 100,000. The surgical specialist workforce is also high at 5.53 per 100,000, but still well short of the 20 per 100,000 recommended by the Lancet Commission on Global Surgery. Pakistan's health system governance, however, is quite different. Whereas countries who have already taken on the National Surgical, Obstetric, and Anesthesia planning process have had centralized governance, Pakistan's governance is devolved or decentralized, where the federal government sets forth a national policy vision, but it's really up to the provinces to decide what their own policies should look like, to shape their own policies in a context-specific way, and to implement those policies within the provinces. When we look at external health expenditure, Pakistan's external health expenditure is low at $1.425 US per capita compared to other countries that have taken on the NSOAP process. And its out-of-pocket health expenditure per capita is quite high at $25.3 spent by patients using the health system. From a workforce perspective, there's a significant gap between the sanctioned positions for surgeons, obstetricians, and anesthetists and the actual filled positions across those 3 specialties. From an infrastructure perspective, several issues in the infrastructure lead to delays for patients seeking care. In the first delay, a high patient decision time delays patients who are seeking care. There are several second delays in reaching care. The first is poor road infrastructure that prevents patients from reaching care on time. Then the use of rickshaws and taxis instead of ambulances also delays patients seeking care. And finally, a high hospital transit time prevents patients from reaching the care that they need. The third delay is in a high physician diagnostic time. And these 3 levels of delays combined in the infrastructure system all prevent patients from seeking care in a timely manner. From a financing perspective, current health expenditure in Pakistan is approximately 38 US dollars per capita. Almost 70% of this health spending, however, is done in the private system, where 66% of health expenditures are out of pocket from the patients. And this high out-of-pocket expenditure puts many patients at risk of catastrophic expenditure and impoverishing expenditure when they seek surgical care. In public facilities, for patients who are seeking emergency obstetric care, 82% face financial catastrophe from the unforeseen costs and transportation costs associated with seeking care. In private facilities in Pakistan, this increases to 96% of patients who face financial catastrophe because of the treatment costs. In Pakistan, many patients are required to travel over 5 kilometers to the hospital, and over half of these patients are unable to pay for transit costs. Many of these patients end up taking on loans to cover these costs. Pakistan uses a monthly hospital report for secondary hospitals, and approximately 93% of facilities across the country send these in every month. Now I'll briefly provide an update on the National Vision for Surgical Care 2025. To give a background, in 2016, Pakistan set forth its National Health Vision 2016 to 2025. This National Health Vision outlined the federal government's vision for healthcare in the country and gave a roadmap for the province's roles to create context-specific policies and to implement them at the provincial level. This National Health Vision, however, did not discuss or outline any plan for surgical care in the country. The role of the National Vision for Surgical Care in the health strategy is to create an addendum that puts forth a surgical policy alongside any of the other policies in the National Health Strategy, such as the HIV strategy or the non-communicable diseases strategy. The surgical strategy is meant to complement these things so the country can move forward with a plan for treating patients with surgical diseases. Pakistan, however, with its decentralized governance, has taken on a unique approach to sorting out this process. At first, a National Vision for Surgical Care Steering Committee and Technical Working Group were formed, and these groups held in November 2018 a national stakeholders meeting in Islamabad. From this stakeholders meeting, there was a consensus statement put forward where all stakeholders were aligned. After that, the Technical Working Group and Steering Committee went forward and drafted a National Vision for Surgical Care document. This document has the goal of providing a roadmap for each of the provinces to then create their own provincial surgical, obstetric, and anesthesia plan, which they can then implement in a context provincial specific way. We're calling these PSOPs. An example governance model of how this might look going forward would be to have provincial steering committees leading their PSOPs, who then have designated provincial coordinators that interface with the National Steering Committee to drive these policies forward in Pakistan. This entire process had its beginnings in May 2016 at the World Health Assembly and is nearing the completion of the National Vision for Surgical Care. In May 2016, a group of stakeholders from Pakistan attended the World Health Assembly and learned of the NSOAP process. Then, in March 2018, some of those stakeholders attended a meeting in Dubai on national surgical, obstetric, and anesthesia care planning processes. Following that, in May 2018, those Pakistani stakeholders sought out international stakeholder commitment in meetings at the WHA 2018, as well as meetings within Pakistan. In August 2018, the Indus Health Network, which is the health system in Pakistan supporting the National Vision for Surgical Care process, signed a letter of understanding with the Ministry of National Health Regulation, Services, and Coordination. Following that, in November 2018, there was a broad international stakeholders conference in Islamabad, and this stakeholders conference involved federal industry officials, provincial health departments, international experts and multilateral stakeholders, academic and professional societies from within Pakistan, as well as public and private surgical care providers from across the country. As a result of this, all stakeholders joined together to write a consensus statement that was signed off on by the ministry in 2019. In February 2019, the technical working group started drafting the National Vision for Surgical Care document. Following drafting of the document, the technical working group and steering committee team took the draft to each of the 4 Pakistani provinces, first in Quetta, then Lahore, then in Karachi, and then in Peshawar, where provincial engagement meetings gave each province and stakeholders there an opportunity to give comments and feedback on the national document and outline changes they thought were important before national policy was put forward. Following the provincial engagement meetings, the technical working group is finalizing the National Vision for Surgical Care document, incorporating all of the provincial feedback and going forward with a unified national document. This document is planned to be finalized in May 2019, with a planned launch of the National Vision for Surgical Care document in mid-2019. So, as we've gone from national stakeholders meeting to consensus statement to draft of the National Vision for Surgical Care document to provincial engagements to finalizing the National Vision for Surgical Care document to a launch in mid-2019, the final step of the NVSC to PSOP process will be for the provinces to create their own provincial surgical obstetric and anesthesia plans, or PSOPs, and the goal timeline for this is December 2019. Thank you very much for your attention and your interest in Pakistan's National Vision for Surgical Care 2025. And the goal of this document was first to outline the current status of surgical obstetric and anesthesia care in Pakistan, then to outline the overall vision and mission of the surgical obstetric and anesthesia care plan in Pakistan and what the goals for that document and plan would be. It put forth strategies to improve access to quality surgical obstetric and anesthesia care. It set forth indicators and time-bound targets for strengthening the surgical system, and finally provided a roadmap for provincial-specific strategies, or PSOPs, as they've been called.